Welcome to Thursday Thought Leaders with Harvinder Narula on BW Healthcare World. Healthcare is going through a seismic transformation driven by tech advancements. These advancements, based on AI and data analytics, are making healthcare more personalized, therefore more precise. To discuss the role and impact of I have with me Mr. Sudhir Kesavan, who is the Chief Operating Officer of Citius Tech. Welcome, Mr. Sudhir Kesavan, to BW Healthcare World. Sudhir, thank you so much for taking out time to be with us at BW Healthcare World this morning. Uh, Sudhir, you're at the cusp of all transformational stuff that is happening in the healthcare and bringing in the technology. So, might my first question be related to AI? AI is becoming increasingly integrated into our day-to-day work of the technology teams. What are some of the practical ways you see AI changing how software is built and services are delivered in the healthcare IT sector?
Arvinder, first of all, thank you. Thank you for having me. You started off with the question that's perplexing all of software industry. Uh, but yeah, we have a way of thinking about it. So, a lot of software work happens as what we refer to as outside of the loop. And then there's a lot of work that happens in the inner loop. So people tend to think about the inner loop most often, which is, the act of actually code generation. But like any program or project, it is the design of the specification, the understanding of the specifications, the deployment of the specifications that really makes a big difference, right? And a lot of things can go wrong if you don't get your requirements right, if you don't get your design right, if you don't get the actual deployment right. And the things that can go wrong when you're actually doing the code generation part is limited in scope, if you will. So if I were to use an analogy of a house construction, right? Your specifications about what you need, your specifications about the material, the design, all of that in some sense can have a larger impact on client satisfaction, budget, etc., than the actual masonry act or the painting act itself. Right? Things can go wrong there. But if you get the design wrong, if you get the architecture wrong, if you get the material wrong, you have a lot more debt in future. So the reason I bring this about is we've come to this conclusion that the outer loop is going to become smarter and what we refer to as more and more agentic, where a lot of the work is going to be done by AI, right? Assisted by experts in that specific domain area. Now, these experts are going to be able to synthesize a lot more information than what was possible. They're going to be able to synthesize that information in a much shorter cycle time than possible. They're going to be able to validate that as well in a much shorter cycle than possible in a much more efficient model. But if you go to the inner loop, now that loop we look at it as more assistive loops. Like for example, you and me using Chat GPT, right? Similarly, in the engineer's life or the business analyst life, they're going to have an interface through which they can communicate work. That interface is going to generate stuff that you can validate. And if you validate and you find it right, you can just integrate it into your work and move along, right? So that's the two worlds we see. We see the big things being assisted by agentic use cases. We see the actual generative use cases in the assistive world. And that's how we are building what we are building for our clients. Uh, uh, Having said that, overall, if you ask me what does this mean and what are the implications of this, uh, I think the significant implication is going to be that the cycle time to build stuff is going to collapse. The uh, like anytime it happens, right? What becomes abundant, the corollary of it becomes, the place where value then comes in. So, for example, if the act of generation becomes abundant, then the act of system design and system specifications is where value lies, right? Uh, it's just a simple factor, right? That whatever becomes abundant becomes commoditized, and whatever, therefore, the value then goes to the next place. So the act of specifying, designing, the fact of assembling, that's where the next value will lie and value will accrete. Now, if you think about it in terms of, so that's about the software industry. Now, if you think about it in terms of healthcare itself and how we apply this to healthcare, the digitization of healthcare has been taking place for a long time, right? And I'm sure we will dwell upon this in our conversation, but uh, the work that we do and how do we give access to healthcare to the remotest parts of the customer teams that we service, bringing down the cost of healthcare, bringing more intelligence, reducing the burden on nurses, reducing the burden on healthcare professionals, physicians, is a massive opportunity. And that's where, this ability to generate software faster and probably of higher quality and iterate faster will allow us to innovate better, because innovation, Harbinda, as you know, innovation is a factor of iterations. So the
Correct.
frequency of iterations and failing better is essentially what makes innovation real. So I see, yes, there is going to be a shift in where value lies in software engineering,
Mhm.
and AI is going to help with that, both the harder aspects of design, architecture, as well as the generative aspects of doing faster coding. But more importantly, it is going to allow faster cycle times of innovation and then make more innovation meaningful.
So they, AI is rising. The use of AI is rising in every industries and in healthcare as well. How do you see the mix of skills needed within the healthcare technology teams changing? And what are some of the biggest adjustments that the companies will need to make the future to be future ready?
Yeah. I think it will be useful for us to think about, what will not change, right, as a paradigm, right? So, say, for example, 5 years from now, will the healthcare industry require technologists to know less healthcare? The answer is no. Even 5 years from now, or 10 years from now, or 15 years from now, you would want technologists to know more healthcare, be more deeper in the healthcare domain. Right? So, therefore, the foundation has to be that your ability to go deeper into healthcare and make it more real is going to be more important than the technology that you apply to it. For example, we have seen multiple waves. We have seen waves of cloud coming in. We have seen waves of data coming in. Now we are seeing wave of AI coming in. But in all of that, the technologist's understanding of the healthcare domain has only needed to go deeper and deeper. Right. So as AI steps in, I expect nothing less. The advantage of AI is AI's ability to understand unstructured information. Now, for example, if you define that a particular comorbidity patient, probably suffering from diabetes as the principal disease for which the person is seeking management, actually look at it, the individual will have multiple ailments, including kidney problems, etc. Right? So now you want to treat that person holistically, right? And to be able to treat that person holistically, you want to ensure that the physician has all the information and the synthesis of that information available to the physician. Right? And the physician focuses on that synthesis and is, of course, able to question that synthesis as to why that synthesis was achieved and why some other options were left out. Now, if you are able to bring that together through AI, it can happen only if you're not just able to read numerical information or structured information. If you are able to read what's the typical clinical pathway, that somebody who's suffering from four comorbidities together and the pathology report says that these numbers don't seem to be where they need to be. What are the likely causes of it? Right? You gain that with experience, you gain that with internship and several years of experience. But if you're also able to augment this information with AI, and AI's ability here is not just numerical number crunching, but also the ability to understand that this unstructured, if patient has A, B, C, then possibly look at this. That's where AI is coming in. The ability to understand clinical pathways, which are typical textbook or experience based, and serve that up as a synthesized information such that a physician can take a better call, is where I see AI, especially today's AI, significantly breaking through.
I couldn't agree more with you because one of the big issues that people or the doctors have been facing is that while they take full care and they have the knowledge, there's sometimes it's very human to miss out on something. So the AI will ensure that your doctor is looking at the holistic side of the patient and not missing out something which is not in the face when he's examining the patient. But there's a challenge, Sudhir, that we have been seeing is the adoption of technology. Now, adoption of technology, the parameter, if you would just go to a hospital and see the technology being adopted by the doctors, fantastic, it's great. But we have a large number of doctors who are in the private practice, single standalone clinics. The they don't seem to be adopting, especially the senior doctors in age. They Do you think they are adopting technology as fast as they should be doing it? And how can we make a senior doctor in a private practice more resilient to adopting these new technologies? Because in my opinion, not looking at what is the latest technology is also sometimes unethical if you're not able to upskill yourself.
Yeah. I, 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 I think the promise of technology is to both democratize the reach of these technologies as well as lower the cost of the reach of these technologies, right? And we are looking at an order of magnitude decrease. But the question that Harbinder you're asking is not about, yes, technology cost may go down by 100x, but how do I change the basic problem of, you know, adoption? Like how do we get people to adopt? And yes, it is easier to do in a centralized ecosystem. It is perhaps even easier to do in a federated ecosystem. But in a decentralized ecosystem, it is definitely challenging, right? I think what I have, uh, I come back to empowering the customer, and nothing changes the ecosystem to adopt better behavior than empowering the customer. So if you look at it, I'll give you a different analogy. Uh, Till Geo came in, this was 2016, and it is surprising for us to recognize it. India had just 30 million mobile users. Today, we don't even believe that number. I have tested this out. I asked people, when did India have 30 million mobile users? And everybody goes back to 2005, 2008, or maybe 2010. But the reality is, it was 2016. And Geo came in, democratized mobile access, and then suddenly, so much opened up in terms of giving the that particular consumer the option of access to capabilities which are available only to the urban users. And I think as we democratize healthcare and provide the ability of healthcare to be available at a much cheaper cost to serve, patients will start demanding aspects of uh, aspects of technology, which the physicians will then be forced to administer through whatever form they can. Now they may form smaller collectives in order to be able to do it, or they may individually decide to adopt it. But I think patient empowerment is going to be something that I expect governments to push quite hard for. Uh, and we see several examples of it. I think I have a lot of faith in uh, human behavior and its incentives towards bettering itself. And if the cost of betterment is really cheap and probably at the same cost at what they spend today, and they can get more value for it, I expect them to go demand more value for it or shift with vote with their feet. So I think that's the scale of this shift, because it's not incremental, uh, can actually empower. Now, I tend to be an optimist on this, but I do think that decentralized change or change adoption happens when uh, the incentive to change shifts from your ability to change to the consumer or the patient that you're serving, just not walking through your door because they are getting a better service somewhere else, and that's what will play out.
Sudhir, I'll go back to my earlier question where you were talking about the teams need to have deeper knowledge, and with time they will need to even go deeper. Why is this domain knowledge so critical now, and what impact does it have on the solutions being developed for the healthcare industry? How does deep domain knowledge impact the operational outcomes? And in the end, in our industry, it's all about the patient outcomes.
Yeah. The currency of healthcare is lives, Harbinder. Like, I have spent a lot of time on financial services. I've spent some amount of time in other industries as well. But if you think about it, in healthcare, the currency is pretty straightforward. It is improvement in lives, if not the saving of, lives itself. So I'll give you two examples, right? Uh, let's look at an example of a patient who is hospitalized, has multiple devices connected to each other. And if you think about a typical screen, and we can take an extreme scenario of an ICU and then simplify it further, right? You see so many monitors, and each of them, are capturing the data that they require to capture. And then you see this file typically placed at the foot of the bed or the side of the bed, which has the last statistics that have been noted physically by the nurse, right? So if you think about it from a physician's point of view, the physician comes in, looks at that report because that was the last status update, and then looks at all the data points that are there. And then, through their his or her experience, they do a mental calculation and provide that, yes, this is what I think the diagnosis is, this should be what the prognosis is. I'll give you a simple example of the technologists. Now, the technologists might think in the earlier day, I have digitized this information to be able to capture different parts of the human body and how they are behaving. And that is visible on a screen to the physician. So in earlier days, that itself was a big achievement. So, so you could have a Philips machine, a GE machine, etc., just showcasing that data, perhaps even in real time or with a slight latency. And that itself was very useful to the physician. But today, what the physician requires is correlate all of these data points. Now, if you're a technologist, technology will say, no problem. I'll extract all of these data points, create a new screen for it, and on that screen, I will show you. And when the technologist tries to do that, they recognize that, oops, this machine sends data out in a different format. That machine sends data out in a different format, right? And then you get into the standardization of, okay, let's standardize what the metadata of healthcare is. And if you standardize the metadata of healthcare, you can't rely, it can't be with a private company. It has to be an agency, a body that governs that jurisdiction that can only define it. And then everybody else complies to it. Right? Now, in order to comply to it, just think about it from a technologist perspective. The technologist can't treat any data as any data. I have been displaying it, so it's good enough. Now, the technologist has to be able to comply to that coherent standard, the coherent metadata of healthcare, if you will, such that that information can be synthesized, and the physician's need for looking at a synthesized information and what it means is served. So this cannot be accomplished without the technologist's understanding of what data means and not just show it as a display. So yesterday it was about displaying information. Today it is about synthesizing that information. I'll give you uh, a more complex example of something we are actually working on with few of our clients, essentially in the space of digital pathology. So if you think about it, you have the modality of a CT scan, you have the modality of an X-ray, you have the modality of a pathology report. And we are all used to getting these reports in very different formats. Like we know X-ray looks different from a pathology report, which looks different from a CT scan. Now, if you think about it from a physician's perspective, the physician looks at the X-ray, looks at the CT scan, looks at the pathology report, and is correlating. Today, the physician is expecting, can I look at all of these together? And can you synthesize that for me so that I don't miss out on something? Now, to be able to, and this is a real, an absolutely real use case, right? You go with somebody who has breast cancer, right? Now you're looking at multiple reports, and you want the disease you're treating and the prognosis you want to give is all concentrated on that individual and that human being. And you want all of this to come together. But today, there is no way you can bring an X-ray and a CT scan together unless you create this universal viewer within an analytics and AI analytics, which looks at pathology reports as well as these scans and is able to suggest to the physician that, possibly this is what you need to look for, right? And for a technologist to be able to do that, you can imagine the depth of understanding that the technologist would need to be able to pull that off in favor of the physician. So, I think that's essentially why I feel that, while technology has made progress, the demand from technology is increasing. And as the demand increases, the depth of understanding of the domain, from the technologist increases.
I think, Sudhir, it's a it's a chicken and egg story because uh, you know uh, what the we've always believed. I remember when the technology at any point in time when it was changing, transforming the industries, we've always felt that technology is an enabler. It has to enable whatever is the requirement, and
Yep.
requirement typically comes from the in this industry, the doctors, the surgeons, and how they are able to integrate the technology with everything else, not just the technology in terms of the office of the clinician, but also with the the equipment that they are using and the data being thrown up by that particular equipment. And accuracy is the key.
Yep.
you know uh, Stemming from that, what comes to our minds there is that technology in healthcare, when it comes from the new therapies being brought up, the new technology, the medical equipment that is being developed, it is changing at a pace that we have never experienced before.
Yep.
So, in this fast moving field of healthcare technology, how do organizations keep new ideas flowing, ensuring that they are actually being implemented to make a difference while integrating with every other piece of technology being used in the hospital?
That's a tough one. And I think it is technology service providers like ourselves who also need to ensure that, in this case, to be able to use the technology. Like, for example, we believe that, uh, let's not use the word transformation so much. Let's use the word of reducing physician burden, reducing nurse burden. And the reason we adopt that is, therefore, that changes how you design your solution. Like there is an existing workflow, and more often than not, the closer you go to the patient, other than administrative workflows, the closer you go to the patient, you actually don't want the workflow to change. You want the workflow to become seamless and behind the scenes. So, something as simple as clinician notes through ambient listening. Now, this is just not about speech to text. This is about being able to convert that speech to text to to the way a physician would put the notes down, right? Categorized, action oriented, empathetic, etc. Right? Now that happens behind the scenes. The physician doesn't need to do anything. Like so, I think there's a lot of design nuance to how we create these solutions. Inevitably, there will be certain solutions that will require retraining. But if we keep these design principles that we are not here to replace a physician, etc., those are things that we should not, that, if you're working on it, then you should keep it out of the domain of how do you impact and create scaled impact. A lot of solutions are about improving the lives of the nurses, the physicians today. And for that, embedding these solutions in the flow of work that they are currently in can go a long way in their adoption and the actual KPI moving. The more for incremental stuff we create friction in the design of the solution, we actually impede adoption. So I'm a big believer that, be very clear on what is truly transformational. And in that transformational, you better have more than 10x impact, right? Because transformation requires a cost to pay. Whereas a lot of solutions can be implemented where they just become part of the flow of work and actually take the technology behind the scenes while creating significant incremental value. And that's a design aspect.
So that new technologies come in. They are the company tries to reach out to the users or the user organizations to start adopting it. When it comes to a point where that new technology hits the market, as a business leader, what are some of the key things that leaders like you need to focus on to ensure successful outcomes, which are basically emerging out of uh, adoption of the technology fast enough?
It is interesting you asked that question because, I keep telling my team when you launch something new, just be sure that you don't forget the outcome for your customer, not the outcome for you, the outcome for your customer, which inevitably is to do with, either efficiency improvement or patient outcomes, right? Either the people who serve patients or the patient itself, there is an improvement in their experience and their quality. Exactly. Like I said, healthcare's currency is lives, right? And therefore, what I tell people is don't think about your revenue, your margins, etc. When you launch something, think about the number of iterations and the speed at which those iterations can occur, because that's where real learning is. And that's where you become really goal oriented in ensuring that that particular outcome is achieved. So, in fact, even in our KPIs, when we launch something new, we actually don't measure what's the revenue impact of that measure. What we measure is what is the frequency in which customers are saying, yes, we'll experiment with you, we'll learn with you, let's do this together. How many experiments can be run in parallel? And are we making progress towards the intended outcome? Because we can create a solution, we can think about it in best of terms, but as soon as you deploy a solution in the market, that's when the rubber hits the road, and you need to start modifying the solution to meet the standards and the context of the space in which you are deploying that solution and the people in which you are deploying that solution, etc. So it comes down to me, the direction that we set for the team, which is very outcome oriented for the end customer, the measurements that we provide, so that there is no dissonance between what we say and how we measure. The measurements tend to be about frequency and outcomes. Because if you get that process right, then long term, you know whether to amplify that solution or to dampen that solution or to pivot, and the numbers will happen. So that's the model that we apply.
Apart from any technology organizations team, specifically when it comes to healthcare and the adoption of technology in healthcare, apart from the large hospital chains that are there, and between them and the smaller standalone clinics, we have a long tail of small nursing homes, 50 bedded hospitals, 100 bedded hospitals. Now, the question of every hospital owner when they are adopting any new technology is the cost, and how long will it be before this technology that they adopt becomes redundant and there's something new that comes in.
Yep.
This pushes a pressure on them to take a lot of time to either decide or let it be. you know and so, one thing that comes to my mind is that this has to become uh, a culture in any healthcare setup, that technology should be adopted. We should look at how we can innovate what we are doing and how we are doing it. What do you think the healthcare industry should be doing to create a culture of innovation at their workplace?
That's a tough one, because the culture of innovation uh, is really a leadership ask, right? And culture per se is a set of behaviors, and those behaviors inevitably stick if the leadership manifests those behaviors, because you need to role model those behaviors, right? And then those behaviors need to be reflected in what you measure and what you direct your team and what you uh, essentially sponsor. Now, the sponsorship could be rewards and recognition, could be strategic funding of some initiative. It also is about what you will not do, right? But very specifically with respect to technology, uh, I think the ability to become more efficient, the ability to attract the right talent to serve the customers that you need, or the patients that you need, is what should drive this behavior. Technology per se does not have a value if it does not reduce the cost to serve patients or improve your outcomes. So if you have a technology that achieves both, which is reduce the cost to serve, improve patient outcomes, reduce physician burden, nurse burden, if you have the technology and still you are being on the fence that, should I do it? If I waited long enough, this will also change. My amortization will go for a toss. Maybe I should just wait it. In any case, there is enough demand in the market. I don't need to change. That's a very difficult behavior to mitigate against. We do think that regulations can go a long way, right? If you look at the US market, it was a regulation that forced EHRs to be mandated in the market, right? It will be regulations that will allow for healthcare data to be exchanged. Now, healthcare data cannot be exchanged if the underlying data is already not digitized. So I think there are certain technologies, usages, irrespective of size and scale, where even the long tail can be forced to adopt by regulations mandating it. Right? And if the solution providers do a good enough job of it, then the cost to serve the patient reduces inefficiencies that are there existing, and therefore the cost to serve the patient doesn't increase, the cost of running the shop doesn't increase. but you extract the inefficiency out and you put new technology in. Or overall in the market, the standard of care elevates, and therefore the cost to serve is paid for by insurance, or people are ready to pay for it. There are multiple models of subsidy, insurance, people's readiness to pay for it that can work out, or just inefficiency attraction. So I think regulations can force a certain behavior, but really, leadership is to me, leadership is key, right? Uh, and without that, a culture of innovation, Harbinder, I have not seen it taking place. Role modeling, leadership, measurements, endorsing what you really stand by, and not endorsing what you don't want to stand by. Those are everyday things. Those are not, vision statements on a board, or what you tell talent when they walk in, and then forget about.
I think it's about changing the mindset of the leadership. Yeah.
Yes.
So the what makes Citius Tech different from any other technology company working in the healthcare space?
I think we are born for healthcare. Like, I tell people that tomorrow, if you could remove technology from Citius Tech, right, you'll still be left with domain, right? So we're genuinely passionate about uh, deepening our knowledge. I'll give you a different example, right? Last year, we got selected by AWS as their North America Partner of the Year. This is the first time that we actually competed in that space, and we won this. Now, the reason we won this is because our specializations tend to be different. Now, other people will have specializations around some technology track. Our specializations tend to be around, you know, imaging. We probably are the world's top three in imaging analytics, right? We count our specializations not in terms of imaging, though. We count our specializations on CKD, on pulmonary, on ophthalmology, right? Now, a typical technology company will say that, they do AI. For us, it is really about, is it applied to oncology? Within oncology, is it applied to breast cancer? Or are you talking about ophthalmology? So our specializations tend to go very deep. And that's why we have respect in the industry. And those are the kind of problems we love to solve. If you, frankly speaking, like, we met a very senior client of ours, and he was telling us that, uh, see, guys, you're specialists. When I have a problem of that nature, I come to you. All of these problems, the rest of them can solve. So don't worry about it, right? And that's a sense of pride for us that we have been able to carve out that niche for ourselves, where we can speak with our customer in the language of their business customer, because our customer tends to be the CIO, but the CIO of a health system spends day in and day out with, you know, the healthcare professionals. And we speak that same language to the CIO. We don't speak a technologist language, we speak a health tech language to them. And I think that's our unique differentiator.
Fantastic. And so, Sudhirji, what is in store for Citius Tech in the near future?
I think clearly we will have to reimagine how software itself happens. So that's one. So reimagining the core of software business itself is one. There is a very new foundation through AI that our customers will build, which is very different from the mobile world or the data world. This will build on top of all of that. So there's a new foundation itself that is going to be laid for the AI world. It's a new platform in itself. So building that new foundation. The third is unlocking proprietary knowledge, which is unstructured. I think that can unlock significant amount of value for the entire ecosystem itself. And then accelerating how innovation happens. So if we were to ask, the four pillars on which we are thinking about ourselves is reimagining our core business, really looking at how do I, unlock proprietary knowledge for our customers? How do I accelerate innovation with, the pace at which technology itself is moving? Can I really accelerate it? And if I can accelerate it, the kind of impact that it can have. Uh, that's what our strategy is. Otherwise, yeah, navigating that change is what is there for Citius Tech. Uh, we would like I said, we tend to think about things that don't change. So years from now, if customers think about us, we want three words. They are part of the healthcare ecosystem. They continue to be innovative. They tend to have the best health tech talent. Those three things I think will endure for us.
Sudhir, one thing that comes to my mind is that, when I speak to a lot of people, doctors, and when we talk about the medical education in our country, they've been saying that, they are teaching medical to the student, but when the person turns into a doctor and starts coming to a real world, he does not know how to manage his practice, right? So nobody is teaching him soft skills, etc. Now, after speaking to you, the other thing that comes to my mind is there a need for orienting a medical student to have a mindset of technology and technology advancement in those formative years when he's learning healthcare, when he's learning medical? Do you think that this needs to become an integral part of the education system for healthcare?
Oh, absolutely. I can't tell you this enough. In fact, we have about 60 physicians on our rolls, right? Now, you'll be surprised what our physicians are doing in our technology company, but these are inevitably people who were in the medical profession for several years. Like, we have an MD on our rolls, etc., who then realized the impact that they can have through technology and then shifted over because they found their calling in helping the ecosystem itself evolve. The reason I believe so strongly is really the passion of these folks, because I am ultimately biased because I'm a seller of technology. But when I see the passion with which these professionals who come into the technology domain after leaving another professional career, which is a lifelong career for them, and they come into the technology domain, the passion that they show in being able to solve problems for their community through technology, and how they are really gearing themselves up to scale it, proves to me that this should be completely left shifted. It should be part of the art of the possible teaching that happens during the MBBS MD years. Absolutely.
And Sudhir, my last question to you is a question which is about you. I remember when we were in the initial conversation, you were telling me how much you travel to Bombay, Chennai, and I know that you have very, very busy customer meetings. Uh, you know, and I'd done a conference on this when I was trying to address, and I said that, what, if there's someone in the hierarchy in an organization who needs overall mental well-being, it's the people at the leadership level. They are maybe having a smiling face, wearing a suit, but the tension of the P&L, team management, sales coming in, and also they're all human beings, so they have a family at the other end. How do you keep yourself away from a burnout? How do you keep yourself relevant to the times while you're trying to manage between work and home? Any hobbies that you are into that keep you still smiling?
Yeah. I think I think the first thing is probably, I've been able to synthesize my the three big things, right? The work environment, the family environment, and the me environment, right? I think I learned a bit early on the need to identify me as itself a time and space that I need to provide to. And then I work towards ensuring that in my ecosystem of work and family, I'm able to synthesize them versus trying to seek a balance and trying to prioritize. Because there are very few things that you can prioritize on a daily basis, but possibly you can prioritize things on a weekly and monthly basis. You can give attention to things. Uh, the second is actively recognizing that mental health and mental well-being affects not just you, but everybody around you. And therefore, it is something that you need to build as a discipline. Uh, and then recognizing my own triggers and cues. Uh, I'm still a novice at this, but I've reached the stage of at least understanding what my triggers are, what my cues are, and what do I need to decompress and de-stress. And then I figure out, simple exercise routines for in the moment, more exercise routines for when I need to go into deep thinking, thoughtful mode, some other routines for, when I really need to isolate myself for me. Right? But thank you for asking that question. This is an area that over the years I've recognized the importance of, and decided to be active about supporting uh, myself. I'm obviously supported by two things. One, my family understands it and actually helps create the environment where there is no unnecessary push and pull around this. The second is waking up to doing something that you enjoy doing, right? I think that that more than anything else kind of acts as the best de-stressor, if you will, right? You come in, you hear stories, you hear people, you solve problems for people, you unlock some things. uh, Many days in these roles don't go as well as you think you would want them to, but the fact that you make progress uh, still helps. So, I would say, I think for me, the fact that I have a supportive family and that I still wake up to, you know, charge into work is what really gets me going. But yeah, there are certain routines that I have established for everything from in the moment to more longer, uh, coping mechanisms, if you will.
If I may ask, what are these things that you do every day that help you do that?
So having a regimented exercise routine,
Uh-huh.
I think starting your day off with doing something that your body tells you to be lazy about, but you still go ahead and do it, itself is, is a kind of discipline. Then in the moment, more breathing routines, right? Uh, then in the moment also, instead of asking why did this happen, changing that question into what happened,
Mm.
right? Because you can get caught up in uh, debilitating a situation which is already tensed by going into why and etc. But instead of that, just asking that one question, and I learned this while listening to a podcast, which is just first question, let it be what happened, and that allows enough space for people to open up and say things. So so there are some in the moment techniques where you don't lead with your system one, but instead of go to system two, and then understand the full context. That inevitably gives you also breathing space, gives you more data points that calms you down. And then of course, I have this habit of escaping to the hills. you know it may be just for 24-hour break, but yeah, I would do that, and the next thing would be driving. Right?
Awesome.
I think, yeah. So yeah, you build up your routines and then you spend time with your family. I think the final thing is just be present. That's something that I was told by a friend, uh, that when you are in a moment, just be in that moment, like be present. And I think that gives the attention to the people who care about you, right?
Got it. No, this is interesting. In fact, usually I've heard people say that focus on the why and not on the what. But this change the paradigm that क्या हुआ है उसको देखो क्यों हुआ है is going to be leading you to overthinking. I'm so glad that you brought this up. So this has been such a brilliant conversation. I was just making some notes while you were talking, because there were certain things that I really believe that these are takeaways from what you've said. One is the shift from thinking that we are looking at integrating data, but we should look at synthesizing data so that it makes sense. So this shift from using the word integrated to synthesize just changed my thought process when you were talking about technology. Second, the very powerful thing, we keep talking about patient centricity, but I think yes, understanding, and when we are running BW Healthcare World, we talk about the business of healthcare. And I keep saying that, even a doctor needs to make money to fend for his family. I think, what you mentioned, that currency of healthcare is life. That is a very powerful thing, because patient centricity to samajh aati hai, but, that's what is making sense. That's your real purpose of whatever you are doing. Third thing that you mentioned was, uh, you don't need to change the workflows, you have to make them seamless. And I could resonate to when my initial days in healthcare, when someone told me that, listen, Harvinder, you don't have to go disrupt everything in healthcare to innovate. You can build efficiencies to start doing things that are being done more efficiently. I think it just brought me back that particular memory. uh, I completely believe when you say that, there's a need for every technology company to focus on deep specialization. Because, as you said, that the currency is in healthcare is life, we are dealing with human life. And unless we go deep down into everything that a doctor does and is intending to do to make things better, the technology has to ride on that empathy factor to bring in and enable him to do what is right thing to do. So enabling the doctor to do the right thing is the most important thing when it comes to technology. And last thing that comes to my mind is when you said reimagine and accelerate. So out of the four pillars, these two pillars that you spoke about, I think resonated with me the most. That you have to keep, and this brought me to my answer to the question that how do you build the culture of innovation when you start reimagining things? And sometimes we need to take ourselves away from the tech platform and get into the mindset of a doctor. I remember going to a newly built hospital facility, and they had this from the OT. They had this bridge connecting them to their R&D center. So the hospital has built an R&D center. They said the surgeon, when he's working on a patient, that time he's like, I wish I could do this better. I wish I had this particular instrument. I wish this instrument, this tool could be turned a little bit. And then after the surgery, they forget about it. But
Exactly.
a person, a surgeon who has this at the back of the mind, if given the ability that, listen, from here, you can immediately go do something about it, that could lead to,
Absolutely. Absolutely.
innovations that otherwise could have been lost. So, you brought up these particular points in your answers, and I think that that really resonated with me. And these are really, really powerful. Sudhirji, thank you so much for taking our time to speak with us at BW Healthcare World. I'm looking forward to meet you in person so that we can have a deeper conversation around this.
Thank you, Arvind. Thank you for everything that you're doing. I know you're really passionate about this subject. Thank you.
Thank you so much, Sudhir.